everyone, today let's learn about pulp vitality tests. So, firstly, what is the importance of vitality tests? It gives accurate diagnosis of true histological status of the pulp, which is obviously important for treatment planning. So, these are all the methods for tooth vitality assessment. Number one, neural sensibility tests like thermal tests, electric pulp test, anesthetic test, and test cavity. Number two, pulp vascularity tests like pulse oximetry, laser Doppler flowmetry, and others, starting with thermal tests. They involve application of heat or cold to the tooth to determine its sensitivity to thermal changes. So obviously it is of two types, heat test and cold test. The results of this tests are however correlated with other tests to ensure validity. Heat test. Materials used are electric heat carrier, hot gutta stick, others like hot water under rubber dam isolation, hot burnisher, hot compound, and dry rubber polishing wheel. There are different techniques of performing this test. Number one, the area is isolated and then is dried, and then a suitable lubricant is applied. And finally, it's exposed to heat. Patient's response is then noted. Number two, using a hot gutta heat is applied to occlusal buccal third of exposed crown. If no response is found, then hot substances move to the central portion of the crown, and then the patient's response is noted. Mechanism of heat test. Heat is applied for 5 seconds. If no response is seen, then the tooth is said to be non-vital. However, the diagnosis is confirmed with other vitality tests. And if because of heat application vasodilation occurs, which increases intrapulpal pressure, which in turn reduces neural excitation threshold, because of which a painful response that lingers on even after the removal of heat stimulus is seen, then it is a case of irreversible pulpitis. And if positive response similar to contralateral control tooth is found, then the pulp is in healthy state. Number two is cold test. So materials used in cold tests are endo ice, CO2 snow, pencil of ice water under rubber dam, and ethyl chloride. So there are different techniques of performing cold tests. Number one, apply cotton pellet saturated with endo ice onto the tooth surface, and then patient's response is noted. Number two, wrap silver of ice in wet gauze and place it against facial surface of the tooth, and then patient's response is noted. Mechanism of cold application. Cold is applied for or less than 15 seconds. If a positive response similar to that of a contralateral control tooth is seen, then the pulp is healthy. And if sharp, short pain that disappears rapidly once the stimulus is removed is seen, then it is a case of reversible pulpitis because the pain disappears once the stimulus is removed. If the pain persists even after the removal of the stimulus, then it is a case of irreversible pulpitis. And if no response is seen, then the tooth is non vital. However, the diagnosis is definitely confirmed with other vitality tests. Diagnostic accuracy. Cold test is said to be the most accurate, which is 86% accurate, and electric pulp test is 81% accurate. Heat test is 71% accurate. Electric pulp test. This is an electric pulp tester. The parts of it are: this is a probe tip, this is a rheostat which shows the readings, metal sheet, and lip clip. Steps of performing electric pulp test. Number 1. Firstly, you need to describe the test to the patient, which would eliminate a biased response. Then we need to isolate the control tooth and also the tooth to be tested with cotton rolls and saliva ejector. We then air dry all teeth. We definitely need to check the functioning of electric pulp tester and determine whether the current is passing through the electrode. Now, the test is performed. First onto the control tooth and then on the tooth in question. The test is always performed on the control tooth prior to the tooth in question. Apply an electrolyte like toothpaste on the tooth electrode and place it against the dried enamel of the crown's occlusobuccal or incisolabial surfaces. Occlusobuccal or incisolabial surfaces. So the location of the tip in the anterior is incisal third and in posterior it is middle third of mesiobuccal cusp of molar and buccal cusp of premolars. So it is important to avoid contacting any restoration in the tooth or adjacent gingival tissue with the electrolyte or electrode. This would cause a false and misleading response. Hence, it is avoided. Completion of circuit. To complete the circuit, we first need to retract the patient's cheek away from the tooth electrode and the electric circuit is completed by either a lip clip is placed over the patient's lip in contact with oral mucosa, or clinician instructs the patient to rest a finger on the metal sheet of the pulp tester. Mechanism of working. Turn the rheostat slowly to introduce minimal current into the tooth and then increase the current slowly Ask the patient to indicate when sensations occur by using such words like tingling or warmth. Record the result according to the numeric scale on the pulp tester. The readings would be shown here. Ask the patient to indicate when the sensation occurs and then record the result and repeat the test for each tooth to be tested. Interpretation. We firstly perform the test on control tooth and then on the tooth in question, and then we compare the results of the control tooth with that of the tooth in question, and then we interpret the results. Normal response, that means a positive response, that means the teeth is vital. Negative response, it denotes non-vital tooth. That means no response was found even when the tester is set at highest electrical excitation value. Early response and delayed response. Both early response and delayed response state that the pulp is in diseased state. But in case of early response, tooth responds to the threshold which is less than the control tooth. Whereas in delayed response, tooth responds at a significantly higher electrical excitation level than control tooth. Anesthetic test. This is a least performed test. In this, we anesthetize one tooth at a time until pain disappears. Test cavity. When drilling through the dentino-enamel junction of an unanesthetized teeth, a painful sensation, if found, indicates some vitality is present in the pulp. Pulse oximetry. Pulse oximetry is a non-invasive method to measure the oxygen saturation levels during the administration of anesthesia or other medications with the help of finger, ear, or foot probes. So, in pulp oximeter, this is a light emitting diode emitting red light at 660 nanometer, and this is a light emitting diode emitting infrared light at 940 nanometer. This is a photo detector. This is the pulse oximeter monitor, and this is the pulse oximeter sensor, and this is the custom made pulse oximeter sensor holder. So the pulse oximeter monitor is connected to pulse oximeter sensor. The pulse oximeter equipment consists of a pulse oximeter monitor which gives the digital display of oxygen saturation values, as you can see here. Oxygen saturation values. This pulse oximeter monitor is connected to a pulse oximeter sensor asset, which is designed to anatomically confirm the areas where oxygen saturation levels have to be assessed. This technique is still in developmental stage and has not yet been commercialized. Thank you.